Hey, Liz.
Oh, hey, Bridget.
Let's talk about Miller-Fisher syndrome.
Okay. So this is a syndrome named after Dr. C. Miller-Fisher.
Huh, okay.
He was a neurologist who spent most of his time at Mass General. He has this syndrome named after him, but also he did a lot of work regarding our understanding of stroke.
Miller-Fisher is a subtype of Guillain-Barré syndrome.
Patients will present with ophthalmoplegia.
Follow my finger. No, you're not. You're not doing it. Follow it. Okay. Oh, okay.
Severe ataxia. And areflexia.
This is an autoimmune disease which progresses over days to weeks. Sometimes the symptoms are preceded by a viral illness.
The type of symptoms and the time course help you differentiate it from other things. For instance, a brainstem stroke, which will come on more acutely, or typical Guillain-Barré, which has weakness in the extremities. People can also be hypersomnolent with the same triad of symptoms as Miller-Fisher syndrome, but in that case we call it Bickerstaff brainstem encephalopathy.
Wash your mouth out. So let's talk about diagnostics. The things that you're going to want to do, you're probably going to want to get a sample of the CSF. And one of the things you're going to see is
albumin-cytologic dissociation.
Huh?
That's a fancy way of saying that protein's elevated, but you have a normal white blood cell count in the CSF.
The other thing that you could check for is an antibody specifically called GQ1B. It's a ganglioside component of the nerve. But it's pretty much a clinical diagnosis, right? So if you really suspect the syndrome, you don't necessarily have to confirm it with the antibody.
Yeah.
Plus, once you send that antibody, it's going to take about 2 weeks to come back. Hopefully you treated them by then.
Other diagnostics would include an EMG and nerve conduction study, which would show you an axonal form of neuropathy rather than a demyelinating one.
Interesting, Liz.
Now we've arrived at treatment. Luckily, nothing too surprising here. The mainstays of the therapeutic approach for Miller-Fisher syndrome are similar to Guillain-Barré: IVIG and plasmapheresis.
Straight up. You can counsel your patients to expect a relatively benign course. Most patients begin the recovery process within a couple of weeks, and most people will completely recover by 6 months.
Some people, though, can have mild deficits, and a small percentage may have recurrence of their disease.
Ooh. Hey, it's been great chatting.
Yeah, real fun time. Here's some take-homes. 1. Symptoms: ophthalmoplegia, ataxia, areflexia. Diagnostics: how about the GQ1B antibody, the CSF, an EMG and nerve conduction study? Or treatment: IVIG and plasmapheresis. Thanks, Miller-Fisher.
Good afternoon. My name's Dr. C. Miller-Fisher. You may have heard of me before. I'm kind of a big deal. I described all lacunar stroke syndromes. I'm not sure if you've heard of these. Maybe a pure motor hemiparesis, a mixed sensory motor stroke, ataxic hemiparesis, or one of my favorites, dysarthria clumsy hand. Back in my day, all I had were these and these. No MRIs for this guy.